If you're looking for online therapy to overcome agoraphobia, then I invite you to go to my website and learn more about the online therapy service that I offer for overcoming agoraphobia via Skype. So I offer Skype therapy sessions for overcoming agoraphobia. And this is a very convenient and very effective way of getting the help that you need when you can't leave the security of your own home because of your agoraphobia. So agoraphobia is very typically associated with a very severe anxiety and fear of having panic attacks when you leave a secure zone, such as your home. It's that fear of losing control that's really at the center of agoraphobia. Now, the real problem that I see over and over again is this tendency to become addicted, if you like, to avoidance. That is, trying to avoid any situation at all that could trigger that fear of having a panic attack. Now, avoidance is a downward strategy. It's not a good thing to cultivate or follow, because it will simply reinforce the underlying anxiety, because avoidance itself is a fear-based reaction. Any kind of reactivity like that is going to feed the underlying anxiety. So we have to do something quite different than avoidance. We have to instead totally change the way that we relate to our anxiety, that's not based on avoidance, but actually is based on developing a conscious, welcoming relationship for those emotions, those parts of ourselves that are in pain and that need our help. So avoidance is not a strategy. Medications is not a good strategy either, because medications really is just another form of avoidance. What is needed and what is recommended by most therapists working in the area of agoraphobia and other severe anxiety disorders is some form of strategic exposure therapy. We need to confront those situations where we feel that anxiety. However, you have to do it in the right way. So traditional exposure therapy is not very good, in my opinion, because it's based entirely on the concept of increased desensitization through exposure. So it's a kind of indirect method of desensitizing yourself to those anxiety reactions. This can work in some situations, but when the anxiety is very severe, it's not enough, and you run the risk of simply intensifying those anxiety reactions. So it has to be done in a very strategic way. And this is what led me to develop mindfulness-based exposure therapy for agoraphobia. So in this approach, we spend a lot of time training with the anxiety reactions themselves. We do this by playing through the scene of the particular challenge that we are training for. We play it through in the mind first of all, and we watch for those anxiety reactions. When we find them, we then start working with them and developing a relationship with the anxiety that's very much based on full conscious awareness, but combined with compassion, combined with a quality of helping that anxiety heal. And this may take some time. It may take a while to discover how to heal that anxiety, but you have to do that before you do the exposure challenge. That's the most important thing here. And this is why mindfulness-based exposure therapy is generally much more effective than classic exposure therapy. We are not trying to desensitize ourselves, but rather we're trying to neutralize the anxiety. We're trying to heal it through developing a conscious, mindful relationship with that anxiety. So a good analogy here is to think of the anxiety as being like a child. If the child is in pain, it needs your compassion and your full engaged presence to help it heal that fear. You need to be able to build that relationship with the child in order to help it heal. When you establish a very strong relationship with the child based on conscious presence and compassion, then that rate of healing increases dramatically. And this is what's needed, really, for the child to develop confidence and overcome its fear. This model applies exactly the same to our own internal emotions. So those emotions of fear require you to establish a strong, compassionate relationship with them. So this means developing a relationship where you are the parent to the emotion, which is like the child. So you're able to stay present, objectively aware, non-reactive, and where you can discover exactly what would help that emotion heal. So building this internal relationship between your true self and the emotion, which we often describe as your little self, is very, very effective. When that internal relationship is strong, then the emotion heals. When it is missing, the emotion cannot heal. So reactivity, like avoidance, simply stops us building that relationship. And this is why avoidance does not help agoraphobia, because it's a form of reaction that takes consciousness away from the emotion that's trying to heal. So that's part of mindfulness therapy, which is what I offer online via Skype. If you'd like to learn more about how to work with your agoraphobia using mindfulness and mindfulness-based exposure therapy, then please contact me and we can schedule a Skype therapy session so you can begin to learn these techniques of working with your agoraphobia. Most people see very good results after the first 3 or 4 weeks once you start practicing what I'll be teaching you during our Skype therapy sessions. So please contact me and let's schedule a Skype therapy session. Thank you.